today I'm here with Kyria. She is a mental health therapist, and she's talking to us today about the heavy topic of shame that is so common among the lost community. So welcome, Kyria. I'm so excited to have you here and talk about the things we have planned for today.
Yeah, me too. Thank you so much for having me. I'm excited. I know it feels weird to say excited to talk about a hard topic, but I think like you and I talked about even then before we scheduled this, there is excitement when you can find people that are willing to have hard conversations so we can take the shame out of all of our sails, as it were.
Yes, thank you for saying that. I lots of times say I'm so excited to bring this or that, but to me it is excitement when you have someone who understands and can kind of give you something to help you walk through this. So, first of all, maybe you can just tell us what made you be an expert on shame.
Yeah, I think I started my master's training in counseling psychology. I want to say it was 2015. So it was new into the field when therapists were just starting to even talk about shame more regularly. Like it's been a topic. We know it's an emotion. We know it's there, but people really kind of got into it about 2015, 2016. And it started, I think, more in the health professionals community. So I really started, I can't remember what started first, if I took a course or I read a book, but I remember just like every time I came across shame being like, whoa, this seems to speak to every single client that I see. This seems to speak to every single experience that I have had. And so to walk it back for anybody that's not familiar with what shame is basically an emotion. It's a feeling that we have. It is rooted in fear. So it's basically this very specific fear that we get of not being good enough or not belonging. So it's that constant not enoughness, the constant I should be doing more, the constant I'm failing, or somehow I'm not going to meet the check boxes to belong in the world, the community, whatever it is. And so my specialization, my training was really formally around eating disorders and around working with people on body trauma. And so shame was coming up left and right when we would talk about that, whether that was someone's body size, someone's relationship with food, someone's health around their body, whatever that was, loss, like what we're going to talk about today, and not being in a position where they saw their bodies as something enough. And so I was seeing it a lot there. And then I just kind of dove in full force. And I think through the training, through my own curiosity, I found a lot of internal healing for a lot of my own trauma, stuff that I never had talked about with my own therapists. And I've really just allowed it to evolve. So now as a therapist that still specializes in eating disorders, still specializes in trauma, I really just introduce myself as a shame therapist, because for anybody that walks in the room, for any speaking event I do, for any client I work with, shame's going to be the underbelly that we need to talk about no matter where we're going and what we're talking about.
Oh my gosh, it's so true. It is almost like you're ashamed to feel shame.
Oh, 100%.
Like there's
Yeah.
shame upon shame upon shame, right?
Right.
So
Because you're supposed to be hustling. You're supposed to be doing. Shame is
yeah.
an emotion that gets in the way. And if you feel it, you're acknowledging that you perceive a threat, that there is a threat to your belonging. There is a threat to your, being enough to other people. So you have to hide it as quickly as possible because you can know it, but you better not let anybody else know it. And that's really, I think, where the shame begets more shame.
Yeah. When you're working with lost moms,
Mm-hmm.
where do you think the shame stems from?
Mm-hmm. I think probably I laugh as you say it because there's this part of me that's just like, yep, we need to unpack all of this, and there's no way we can do it in the amount of time we have today. Which is what you've been talking. I mean, you've done this in other episodes, and I think you get at this in a lot of ways, but I work in the US, so I'm working within the cultural norms of the US and obviously different multicultural aspects of people's identity that live here. And so I can very confidently say that for people that live in the US or in similar countries and places, it's the system within which we're operating. It's a patriarchal system that is defined by certain roles, certain requests, layered on top of that sort of the American dream of you should always be achieving, you should always be doing, you should always be getting to that next level. And so I mean, from the time we're little, we see it. If you were the kid that got A's, you were treated differently than the kid that got C's or D's. If that kid who got a D needed an extension, they definitely weren't going to get it the same as somebody with an A. There's this constant sort of splitting that happens, and everything is graded. It's, body size, grades, the school you went to, your whatever your resume is that you're bringing. And so for all of us, and particularly for biologically female humans, we have been taught with subconscious and conscious levels of bias that our job is to have children and to raise and put healthy children out into the world. And so if you don't want kids, if you experience a loss, or you have a child that then requires different needs or requires a system, a world that looks different than the one that's designed, then the belief that we have is we have somehow failed. We have screwed up. And I think that obviously it's an oversimplification, but that to me is really where it comes from, is the internalization of externalized systems of oppression.
That makes so much sense. You're right, because I don't think I've ever met a lost mother who didn't feel that sense of responsibility or brokenness because they couldn't do the one thing they were supposed to do.
Mm-hmm.
Their body couldn't do the one thing it is designed to do. And so the shame is definitely coming from that.
Yeah.
How do we deal with it? What are the ways to identify? And what, I guess maybe even a different question might be guilt. What's the difference between guilt and shame? Because they feel very similar.
Yeah. I love that you backed up to ask that question, because guilt is this incredibly powerful, beneficial emotion that we need to experience. So guilt is basically, I did something wrong, or feeling like you screwed up in terms of an action. So it's something that we did or didn't do that we have those feelings around. Shame is the belief that I am wrong. I am broken. My body is the problem. And so there could be guilt of like, I remember I worked with a client early in my career who was, I would say, very newly in her recovery, maybe 6 months into her recovery, and she got pregnant. So she was struggling with anorexia nervosa, very low caloric intake. And so a lot of deficit nutritionally for her body. And then also her body being not just weight-wise, BMI stuff we know is BS and obviously not helpful in a variety of ways, but mostly just the fact that her body's sort of systems had been offline for so long, electrolyte imbalances, kind of the inability to move, all these things. Well, she ended up getting pregnant, and this is part of what was motivating her for recovery, was to be able to get her body in a position because she wanted kids. And there was this work that we did, just like getting her to this place of mental and psychological readiness, but also physical readiness. Well, something happened in the pregnancy, and she was kind of forced into a position of choosing to terminate the pregnancy and have a DNC. And a lot of what we talked about is she had a lot of guilt around behaviors that maybe she was still doing with her eating disorder that we could talk about, that there was a little, on a certain level, it was healthy. It was a motivator for us to have some conversations. The fine line is when your body turns that to shame. I'm terrible. I screwed up. Or when you can't take what you need from it to learn and grow, but you hold it forever. So for most of us, it's also this idea of, I think anybody listening, you and I, we could probably come up with a laundry list of things since we were maybe 2, 3, 4, 5 years old that we still haven't forgiven ourselves for. And so that's the other kind of point, is guilt is, I want my daughter to feel guilty sometimes so that she can learn what it feels like to hurt someone's feelings or to not tell the truth. And then I want her to take from it what she can to grow and evolve. For us, if we don't do that, if we keep holding it, that's shame too.
Ooh, that was a great explanation, because it's almost like guilt is something that you can maybe work through a little bit, get some reasoning behind it, get some
Right.
facts lined up, and maybe get yourself out of it. But shame can stick with you for a really long time.
Well, and in that example, even of like, we struggled to to really stop it from becoming shame, because it was, should I even try for this again? Maybe I'm too selfish. Why can't I be doing everything I need to do in my recovery? Which, again, as an eating disorder specialist, it's a minimum of 2 years for full psychological recovery. And that's from like full on integration into care. And so a lot of the work we had to talk about was there were so many factors that we don't understand or know. And your brain is trying to boil this down to one thing. You should have done more. You had more control. And there's a comfort in that, because if we have control of things, even if it sucks, it gives us a sense of understanding. But the reality is, she could have had this loss even if she didn't have an eating disorder. We have no idea how this would have been. We don't know why this occurred. I mean, she got more information as she went and started, that helped us really integrate it. But I think that's the big thing for people is shame is also its number one attempt is to make the information as streamlined as possible, to point all arrows back to you are the problem. Yes. You are responsible for everything that did or didn't happen. And in this case, it's hard not to say that, because it's like, well, it's our body. So how is it not on me?
We have evidence of it.
Right.
Do you think that sometimes, I would say a lot of times, that shame almost becomes like a habit? Like it's almost something that we lean on, that we already know it's our fault, so then no one else can blame it on us.
Ooh, like almost as a protective defense against somebody else doing those things. Like, I'm going to take myself out of the running first.
Like, I'm just going to go ahead and I'm just going to live with this shame and just do with it, because then no one else can come at me with it.
Yeah. So when we experience shame, we know that our brain has 3, what they call strategies of disconnection. So it's 3 ways to deal with it. So again, basically shame is saying you aren't good enough as you are. Here are the rules. This is what you have to do to be good enough to, again, whether that is dressing a certain way, appearing a certain way in the world, getting a certain number of degrees or promotions, whatever it is. So that's a system of rules. When we don't follow those, or when something happens, because again, there's different rules for me when I'm a business owner versus a partner versus a friend versus a caregiver, and all these different things, sometimes those things don't align, and you can't do everything all the time. And so when that happens and we feel shame, our body and our brain basically kind of takes a route of response. So the first is moving towards. Moving towards is the person that suddenly all they do is they take care of everybody around them. They basically make themselves lesser, because they assume the only way that they're going to have merit and value in the world or in that room with other people is to be the one that everybody needs, because they're dependent on them. So it's the yes person that's always taking on every project at work, the person that's constantly doing everything, going a million miles a minute. They are the ones managing the households, doing all these things. The second is moving against. So moving against is kind of becoming oppositional. So we could imagine this within these communities, so there's, especially within the loss community, we see moving against. And then the third one, which we'll talk about, moving away. Moving against is then sort of pushing the whole world away and wanting other people to feel as bad as we do. So it can be being hurtful about that situation. It could be coming at them for anything. So suddenly somebody else, the partner doesn't go buy bananas, and then they come home and you're screaming at them to make them feel like they're failing as a partner, because you internally feel like you're failing as a person, as a partner. And then the third one really gets at what you just asked, which is moving away. And moving away basically says, okay, I'm going to be rejected anyway, so I'm just going to take myself out of this now. And that sort of humor, I mean, we've seen that there's lots of comedians that have talked about the way that they've coped with their body size of, I'm going to make the fat joke so you can't, or the person that makes the joke about being a dumb blonde, or whatever these, stereotypes are. And so for this, what we see is that I think sometimes we move away and we're like, look, I already know this to be true. We don't know it. We're projecting our interpretation onto them, but it feels safer to just assume that to be true than to have hope that someone could see you differently. But the problem is exactly what you said. The more you do that, the more your story is tunnel visioned. All you see is yourself through that lens. So all the data you collect in your daily interactions is data that's going to support that conclusion, even though we don't actually have evidence to back that up.
So what happens if we don't heal this? And I think you and I both have a little story on a perspective of, what happens to the next child.
Mm-hmm. Well, what we know ultimately is, and we could talk about this all across the loss community, we're not talking enough about loss. And the people that are talking about it, it's still a very specific sliver of the story that's being told. And people with a lot, oftentimes people with a lot of privilege. And so we're seeing maybe celebrity people, other people, that doesn't mean their loss isn't equally painful and valid, but there's still a sort of degree of separation from us and maybe the people sharing. And so we are thinking, oh, that's so brave, but we can't do that. You know, they have this status, they have this, they're already up here. They're going to be more okay for doing that. So what we know is that the only way to not have your story become written in shame is to talk about your shame, to say it out loud, to say, I mean, I say this probably 3-4 times a day out loud, where I'm like, so I did this thing this morning. I'm feeling like the worst parent on the planet. Or I had one instance recently where we had a play date with somebody and I got it in my head that I said something, you know, quote unquote wrong, but something that like didn't land the way I meant for it to. I spent 3 days ruminating over this. What was I going to do when I saw this parent again at drop off at school? Because they probably hated me and thought I was the biggest piece of garbage, you know, all these different moments. So I have to say it out loud. And that's the thing that's really scary, is we don't want to talk about it because, again, shame is kind of if we think of all the negative emotions. So I grew up in the Midwest in the US, in Wisconsin. I come from a family of people where if you're sad, if you're angry, if you're frustrated, if you're tired, like you stuff that down and you just do what you need to do and get through it.
Yeah.
And so shame is like the biggest one of those emotions. Like you better hide that and keep going. So we do this, we keep going, we keep it up, and we keep telling ourselves, we're fine. We're fine. We don't need the break. We don't, because we've been doing this, you know, since we were 5, 6, 7. And so what ends up happening is our body's going to reverb eventually. Our body. So for any time something starts to go well, we aren't going to be able to enjoy anything because we're in a state of constantly feeling like it's imposter syndrome or the fear of hypervigilance of what if, what next, what's going to happen.
Yeah.
We also know, and I think this is where we're both going, is so my mom had 3 miscarriages and a stillborn, and prior to getting pregnant with me, and she was told that she was never going to be able to carry a baby to term, that she wasn't going to be able to have children. Intermixed with this, my mom struggled with what we didn't know at the time, but know now was undiagnosed bipolar disorder, which comes with some hypersexuality, some kind of risky behavior, things like that. So there's a lot of shame that I think came up for her later on in life of, again, did I cause this? Did I do this? Did something happen? And also sort of the body not giving her this thing that she wanted. Well, she never talked about that. Nobody, I mean, especially in, you know, the 70s and the 80s, nobody was talking about this whatsoever. So she just kept going. And she was, you know, constantly trying to navigate life. And then she ended up getting pregnant at 35. And she didn't know she was pregnant because she wasn't taking tests. She wasn't worried about it. But she ended up going into the hospital for something happened. And then it turned out she was pregnant. And from that moment, her entire life became about me. Because now, instead of realizing that because she had so much loss, I became such a gift to her, but she didn't know how to make sense of that. She didn't know how to integrate that into, my body is deserving of this. I am deserving of this, or that my body, for whatever reason, could not have these other children, can have this child. So from the time I was born, and this is again, what happens, I think, for a lot of people, I was her world. It was obsessional. It was everything because she was constantly afraid she was going to screw it up. She was constantly afraid she wasn't going to give me enough, do enough, be enough. So everything she did, albeit, I mean, it was wonderful in a lot of ways. And I do believe, you know, now I'm 35, so the same age she was when she had me. I believe everything was rooted in love, but everything was still, it became about her. Everything was about her own shame, and now trying to deal with her shame by doing enough to make up for all the quote unquote past failures and to make sure that she didn't screw this one up. And I think that's the thing that happens for people, is because she never dealt with her shame before, she couldn't come into caregiving and parenthood in the same way that somebody else maybe does that doesn't experience loss like that.
That's such an incredible story. And I think so relatable for those of us who did grow up in those families
Mm-hmm.
where, yeah, you keep that to yourself. You don't need any healing. You just need to get out and go to work and
Right.
forget about it, or
Right.
whatever it is. So yeah.
Or take a day and then the next day you should be fine.
Yes.
Yeah.
Let's just get back to normal. And I think
Mm-hmm.
that definitely is resonant in our community for sure.
Mm-hmm.
And yes, and I have the other side of that where my daughter was born 3 days before the 1 year anniversary of my twins' loss. So I put all the eggs
Mm-hmm.
into her basket, of being the child after I was meant to have twin girls. And then here I
Mm-hmm.
have one girl who I knew was my final hurrah.
Mm-hmm.
And I really needed her to measure up to everything that I had dreamed of, and kind of in a way correct my shame.
Yeah.
I wanted it to just correct and just have her be the thing that made it all okay.
Yeah.
This was okay, and this proves that I'm not broken and
Right.
that everything is going to be okay. Now, needless to say, she's the joy of my life, but she's got her own mind.
Mm-hmm.
And strangely enough, she has her own thoughts and her
Yep.
own ideas of what she wants for her life. And so, yeah, it's a very different experience, maybe living out your shame with someone
Yeah.
else.
Well, and I
Yeah.
think what you just brought up that's super important is, so grief is something we all really struggle with just in general. It's not a
Mm,
process many people really give themselves space or grace to move through.
mm-mm.
And an integral part of the grieving process is forgiveness. And so, in the context of loss, like we're talking about here, it's really hard to grieve something that is both real, but also still doesn't feel real. You were told you're pregnant. You were told, and it obviously depends on everybody's specific experience and what they went through and how long into the pregnancy and all of these different components. But there is a feeling of like, what is this? But you're starting to bond, you're starting to integrate this idea that you are going to have a kid. And for some people, maybe that's news. For some people, that is, what they've been trying for, whatever it is. And then you experience the loss, and now you have to grieve this thing that you don't totally understand what it was. So you're grieving the loss of your baby, you're grieving the loss of time, you're grieving the loss of parts of your body and what your body can or can't do, the pain, and if you're in a relationship with somebody or have loved ones involved.
Yeah.
And I think part of the issue is because we're stuffing and not grieving, then when you had your daughter or when my mom had me, I was enmeshed with her pain and her unresolved grief. So
Mm,
then I was a part of her healing in a way that was all about her. The same way you're seeing this about you, within the expectations, I'm getting my shot, I'm going to do this. We see this even in the context of, I had a patient recently who experienced loss, got pregnant, had a child, and then had a lot of resentment and saying, I don't know if I want to be a parent. And then that feeling of like, but I'm supposed to make this a thing. Like, I experienced this loss and now I had this baby and they're supposed to be my miracle. And what do I do? And so
yeah.
I think it's just this idea of, once there's a loss, the expectations and the narrative changes for each of us, whatever the shame story is, whatever the experience is. It's really hard to undo that until you've grieved whatever it is that you've gone through, and you allow whatever happens in the future to be its own story, to be, your pregnancy with your daughter, your life with your daughter, every day with her, to not be tethered to expectations of what could have been or the pain of what it isn't. And that's true, I think, of parenthood, period, but particularly when we're thinking about loss in this way and then having a child later on.
I think it's a really important thing to be aware of.
Mhm.
if you have a subsequent pregnancy, because there's so many of us that think, oh, well, this is going to make it all better.
Right.
And it actually adds another layer.
Right.
It can add another layer on top of it.
Well, and even on the flip side too, of how often then if somebody, once they've experienced a loss, and if they do have another pregnancy, then they're spending their whole time either kind of on that side of like, it's everything, and sort of the obsessional component of it, or the constant what if and hypervigilance.
Yeah.
Both sides of that cause stress and anxiety that's unhelpful to you and or your child. And so I think those are things too, where how I want to pause and say, how could you not have those feelings? How
Yeah.
could you not feel that constant what if? And then if that baby is, born and we have that child in our lives, how could you not then want to covet everything that is, or feel shame if you aren't coveting everything that is, because you're like, well, I've faced this loss, I should be more grateful.
Yeah.
I don't think it's reasonable to expect we won't feel that way. I think the thing that we're trying to talk about is not talking about those feelings is what gets us stuck in these cycles and makes it painful. Those feelings are totally normal. Those thoughts are totally normal. We just need to normalize talking about those aspects.
Oh my gosh. When you said that, it just made me think, if there's anything less talked about than our loss or grief, it might be this is what happens afterwards. Yeah.
Right.
So what are your recommendations? How do we break the cycle of shame? What are some things that we can do to get ourselves out of it if we realize we're in this cycle?
Well, I think kind of starting with this idea of saying it's not if you feel it, it's you feel it. Like you have shame, whether or not you had loss or not. I could 100% tell you every single person listening to this experienced shame, because it's a universally experienced emotion. We all have it. Whether you grew up in the US or another country, there are certain externalized systems of operation and belief and systems of oppression and merit given, body size, race, gender, all these pieces. We've all got a storyline of how we're supposed to measure up. And we are constantly hyper aware of the ways that we are quote unquote not. So I think for anybody listening to this, whether they directly have experienced the loss with their own bodies or their partners, or they know someone who's experienced it, there is shame around this subject for everybody involved. And so I think the biggest thing is we need to find a way to start talking about it. We need to find a way to say these things out loud. And I'm a mental health therapist, and we're not supposed to use the word crazy. We're not supposed to say these things. There's all this political correctness stuff, but there are days where I want to look at my husband and be like, I feel like I'm going crazy because I know this thought is ridiculous, but I can't let it go. Yeah. I mean, there was a day where I had a conversation. My daughter's name is Everly, and I had to kind of set a boundary with her. And I she was starting to have a tantrum and I had to hold her. The rest of the night, I was like, I think we should call CPS. I think I'm abusive. I went straight there because I should have been able to handle the tantrum and helped her talk through it, because I'm a therapist and I'm supposed to be the perfect parent. And the expectations of, I have to get this right, and kind of the onus of even feeling my mom's story of what my mom went through to get to parenthood. And now I have this gift and I have different resources. And so I think for all of us, just to be able to say, it's going to feel and sound crazy. Again, take the political correctness of saying that word aside for a second. You're going to feel like people are going to judge you, make fun of you, all of those things. And that's not true. And the people that would or do, they weren't safe to begin with, because then what we know is they're only safe if we hide our true selves, and that's not a safe person. So when we look at things like divorce rates and separation after a loss, divorce rates and separation after a subsequent pregnancy, with all these things, what we know is the underlying issue for people is we're not talking about our shame, and we silent suffer. And that silent suffering really creates those storylines that we can't get out of. So I think the second thing, and we can put it in the show notes, is there's something called cognitive distortions. Basically what it is skewed perceptions of how we view the world. My biggest thing I like to tell people when you get started doing any work around shame is recognize how your perceptions are skewed, in what ways. And so there's 12 kind of main ways our brain gets skewed. And then you can kind of see how it shows up for you. And so that's the next step. We talk about it, and then we start to figure out where and how is my brain telling a different story from how someone else is viewing that information? How is it getting skewed towards shame? And once you start to do that, then I think it opens the door to some of the deeper work, the self-forgiveness work, the grieving work. There's a concept called radical acceptance, which is around accepting what you can't control and controlling what you can. And so realizing that, the example of maybe a subsequent pregnancy, you can't control everything that happened up to this point, and you can't control what happens to this pregnancy for most of it. There's certain things we can, but you can control the mindset that you're going to work towards every single day. So this pregnancy doesn't become a constant trauma to live through that then is going to create that wound for you, regardless of what happens with the pregnancy. So I think really kind of thinking about those things. So I can send some resources that we can put in the show notes for people. The hard part is there's no quick solution other than to tell people the most successful thing is to talk about it. To say something, whether it's putting a post reply to anything you do from a blog, replying to your emails, whether it's commenting on a podcast episode, finding somebody in connection, emailing you, emailing me, just putting it somewhere where we're not in a space where we're holding it, because that will automatically dismantle that sort of tunnel vision. And then the rest starts to come after that. And again, eating disorder recovery, I said, is about 2 years psychological. Most shame-based recovery and developing shame resilience is a lifelong process because you will have constant reminders every day of that not enoughness. And so for all of us too, it's how do you see this not as a task to accomplish so you're all better and everything's fine, and instead of saying, gosh, I'm going to deal with this for the rest of my life and what I'm doing doesn't seem to be working. Is there a different way I could approach this that might allow me to, when I feel it, not be so consumed by it?
That's everything, isn't it? Is just aligning yourself with the tools, because this is grief is a lifelong process. Shame is a lifelong situation. It's just getting the tools that you need at your accessibility so that you can just know exactly what to do and take yourself out of it quicker. That's what I tell my audience too all the time. Keep your circle small. It's okay to keep your circle small, especially in the beginning, because you need those people that you can call up and talk to that aren't going to think that you're crazy.
Well, and I think the people that aren't going to impose a timeline, because that's something that we know too, of like, we are already going to self-impose a timeline. We get this amount of time to feel this way, and then we need to move on and everything needs to be fine. And everybody else is moving on. So why are we still struggling? And so I think also the people that recognize that grief doesn't follow a timeline, in particular ambiguous loss like this is, because we can't make sense of it in the same way, because the relationship is something that is different from any type of relationship that you would have with any other being on the planet. And so really thinking about who can hold that space for you, and who are the people that, again, just give you space to be like, of course you're feeling this way. And if you need to be angry, be angry. If you need to be sad, be sad. I think a big thing that I like to tell patients and friends is, I even had a friend the other day, she's like, well, I know I need to be getting up and I need to be doing something. And I was like, look, I get it. You have depression. You're worried that this trauma you've just gone through is going to kick you into depression. And there's a chance it could. And there's a fine line between getting up and asking yourself to keep going and not giving yourself space to just be down for a little while. I will make sure you get out of bed, but you have to give your body the chance to grieve this and to feel everything it's feeling, and to ask yourself to suddenly be ready to get up at 5 a.m. to go work out because you're afraid you're not going to get out of bed all day might be unreasonable, and it might set you up for the downstream sort of fall. And so even those people that are like, I will get you out of bed if it's a problem. And it's okay if today you need to be in bed and you need to just feel whatever this is.
Those feelings are there for a reason. Well, Kyria, this time went way too fast. I know we could talk for hours about this, and it's such an important subject, but I just appreciate everything that you brought for us today and the work that you do in helping so many through all of our shameful times, which is just such a life situation. So Thank you so much for being here with us.
Of course. Thank you.